Hi, I'm Dr. Maisha. Welcome to another episode of Behind Beliefs and Behaviors. And I am grateful to be here today. Um, it's Mental Health Awareness Month. And I was thinking about how I would honor this month and honor mental health awareness because, as we know, mental health is still very much stigmatized in our nation and particularly in certain communities. And of course, many people who share my identity as a Black woman know that in the Black community, we are still working through destigmatizing mental health um, and so I wanted to really share unscripted and a little bit vulnerably today about my journey, and particularly because as I work with organizations, and I recently had just the other day the opportunity to speak with an organization's a community of ERGs. That it was a collaborative training across the leadership and the employee resource groups about psychological safety, and in the context of mental health awareness, as well as in the context of the topic and discussing suicide awareness. And so as I spoke about this, as we talked about this, and I guided the conversation through both didactic training and through interactive discussion. It was revealed that there had been a couple of suicides inside of the organization, and that was one of the reasons why they wanted to have this discussion and this facilitated training. And what I'm aware of, and this is based on my own journey, and in my talks I do share, and particularly in this talk, sometimes in my talks I do share my own struggles with feeling like I didn't belong, and my experiences with isolation and mental health struggle, and even my brushes with suicidality. Um, and so I want to share today about my journey a little bit more because there are people who are open about their struggles with mental health, and oftentimes they're open in order to be able to give voice to others, to be able to share that others are not alone, and to be able to bring awareness to communities and help to destigmatize this conversation around mental health and mental well-being. And so there are people who are very open about that conversation, but then there is a group of people who are not so open about it, who struggle in silence. And then there's this, but there, and so there's an entire group of people who are being given voice to because others are sharing. But there's another subset that I don't think gets talked about, and um, and I feel like that I'm part of that subset. And so, just to share, I think that in retrospect, looking back on my childhood, I probably had suffered from depression as a child. Now, I grew up in a home that witnessing violence. I've been very open about that. I've shared about that, and fortunately, my mother was able to leave her abuser, and the impact of that on her, the impact of that on me and my sisters, the impact of that on our relationship. And again, I've shared this openly. Even we've shared this openly together. And some point, it has impacted. It left an impact, and I think that over time took a toll on me as a teenager. And so, my first brush with feeling like I didn't want to be here and really attempting was when I was a teenager. And at that time, the experience for myself was different from um, when the experience that I share about often in residency. And so when I share often about when I was in residency and the sheer exhaustion, the fatigue, the feeling like I couldn't go on, and this really having this sense of having to put the mask on. And this was the case also when I was in high school, having to put the mask on that I was okay, having to whenever you go outside of the rooms of your house, the doors of your house, what goes on in the house stays in the house. And that was just the that was what we were taught. That was and my understanding, having grown up and under that and later finding out, is that was not just in my home. This was a generational and also a cultural conversation. And so, you know, fortunately, as a teenager, um, I moved through that period, and was able to get to college, but I still suffered from depression in college, and I didn't know what the name of it was. So for those of you who um, are listening, who may have teenagers or may have young adults, may not really recognize what to call it. Now, I will say that the young people are a lot more aware these days, with there being so many campaigns around mental health awareness in children and adolescents. But still, there may be some experience of melancholy. It's not being able to get out of the bed type of depression, but this underlying melancholy, feeling of isolation. That this is kind of what I experienced through uh, college and even through medical school, like just always wanting to be alone, not feeling disconnected, even though I very well could relate to people and um, was very social. When I took the Myers Briggs, which is one of the reasons why I'm so into the Myers Briggs today, I, I, I was tested at an introvert, and there were a couple of other of the combinations that I was referred to the school counselor. And that was one of the things that she shared with me, is to be careful because I had a tendency towards isolation. And sure enough, that was one thing that I struggled with throughout medical school. I was in study groups, but I really had to fight against this melancholy, this experience of just wanting to be alone all of the time and not ever having a full experience of joy and happiness. And so when that of course went into residency, and I think the thing about my experience is that I always had something to focus my attention on. Going to college, getting through college, becoming getting my psychology undergraduate degree was something to focus on, to understand why I thought the way I thought, what was behind some of my thought process and experience, my conditioning. That was all interesting, and it kept me focused. And so same thing into medical school. Like, I was so focused on getting through that low grade experience of melancholy. I just thought, well, this is because I'm tired, I'm studying, I'm overwhelmed, and I just sort of put it off to that. Then in residency, similarly, we understand the nature of this work would require that I would be there's exhaustion associated with it. And so I remember the day that I think my mental health was declining and declining, and I wasn't fully aware, because there were days that I could laugh with my friends. There were days where I felt content. There were days where, even though I was exhausted, I felt like, well, I have a good life. People don't get to do what I do. People don't get to go to medical school. People don't get to be a doctor. Like, I don't have anything. I was raised in a middle class home. I don't have anything to be sad about. That was the narrative in my mind. So why am I feeling this way? And so that narrative continued to weigh as well. And yet here I was in this sort of middle space of melancholy, not quite deep, depression, sadness, but not being able to have a full experience of joy either. And then I was just tired all the time. And I remember that day in residency that I came home and I had had surgery and I had this bottle of pills and I looked down at that bottle of pills and I contemplated what I would do next. And it was the community, it was the people, there were two people that I had that I felt that I could call. And it was just that moment of pause, was the one moment of pause that I had, and the thought of, you know, my dad losing another child, or my mom, or my sisters, you know, that pause and thought that had me pick up the phone. But what I'll share with you is that, and what I haven't shared with many people is that it wasn't the last time. I share about that, but it wasn't the last time. And so as I have floated through life, and I feel when I, had my son, I experienced postpartum depression. I was never really directly asked about it. And I think that because of the stigma, I never thought to speak up about it. And because of my conditioning around speaking up around mental health, I just sort of pushed through. And again, it was just one or two people that I had that checked on me, um, that helped to bring me through these times. And so I share that because my experience, those moments, and I've had several, I've had one other moment, a couple of other moments since then of feeling on that edge of just being tired of life. And it's not, it didn't occur for me like a very deep depression. Like I can't get out of the bed and I'm crying all the time. That it didn't occur for me like that. It occurred as this sort of weight, fatigue, feeling way down, especially having stepped into work of equity, diversity, inclusion, especially as an anti-racism educator, and beginning to really delve into this world of trauma and psychological safety. And the, there's a heaviness that comes with being in that world that that creates a fatigue. And in our leaders, particularly our leaders who are in activism, but oftentimes in just s- people in general, we don't always realize the weight and the heaviness that could be there witnessing all of the things that are going on in the world. And that is vicarious trauma. It is an experience of trauma. And over time, it causes fatigue and it causes, I've never thought about it this way, but life fatigue, like the pain of being, and the pain of having to navigate, um, being here and, um, witnessing the death and destruction of others. And on top of, if you're in a marginalized population, managing your own experience of oppression and subtle acts of aggression can be very tiring. And I just want to share that this is an experience that many people don't talk about, that over time can lead them to that edge. And then people will say, well, I never knew that they were suffering because they're wearing the mask. And so this conversation is so important to be. A question was asked to me when I was leading this talk yesterday or the other day. Um, how can we begin to create safe spaces for these dialogues, or how can we create safe spaces for people to come forward? And I think it's important that storytelling is a part of that, sharing experience is a part of that, and making it safe for people to be able to share those experiences without humiliation, fear of it being used against them, fear of retaliation, fear of punishment for one's mental health gaslighting, all of those things. And so the question is, how do you make it safe for people who are living with mental health challenges and they're living with it behind the mask? Because and it's not, and it doesn't occur as extreme, and it's heavy and weighted. How do we make it safe for people to storytell? Because storytelling is therapeutic. So this is my call to you, is to have this be an inquiry in your family, in your organization. Have this be an inquiry. And if you want assistance with that inquiry, I invite you to invite me into a conversation about how to have these conversations and to really educate of how do you cultivate the kind of safety and trust that helps people to be able to come forward. So please share this episode with your leaders, your friend, your colleague, your family member. And if you want to speak with me about coming in and talking, facilitating a conversation, coaching any of your leaders or staff members, please reach out to me on this platform, or you can go to the website you see here on the screen if you're watching, mindremappingacademy.com if you're listening. As always, please, continue to know that you're not alone. Know that you're not alone. Find the safe people in your life. Be a safe person for someone else. And if you're if you're struggling, 988 is the number that you dial for suicide hotline. And until the next time I see you, please stay safe and stay empowered.